On Women's Day, it is important to speak again on women's urinary health, which you miss out so many times. Remember, when it comes to urinary incontinence or leakage of urine, women suffer more than men, and elderly women suffer more than youngsters. One of the women's incontinence issues that we have always forgotten is stress incontinence or leakage of urine when she coughs, when she jumps, when she runs, when she even laughs. So leakage of urine when a woman runs and jumps and laughs and bends to work or for prayers is called stress incontinence. It can happen postpartum after deliveries or when the pelvic floor does not recoil completely. That means we have not told her about Kegel's exercises, we have not told her about strengthening of the pelvic floor, which has loosened up in the 9 months of pregnancy. And thereafter, post-menopausal, when the pelvic floor, like a hammock, is gradually loosening up. In those situations, you could have a loose pelvic floor, a genuine stress incontinence, a leakage of urine where basic minimal amount of stress, not the mental stress, the stress which actually puts the pelvic floor on stress, like pressing, coughing, running, jumping, and even laughing, makes you leak urine. And that's a women's phenomena. Men don't suffer from this kind of an incontinence called stress incontinence, unless I, as a urologist, did a prostate surgery or a radical robotic prostatectomy, and the pelvic floor, which is already weak in elderly gentlemen, suffers a little bit of brunt, which takes time to recover. So that's a stress incontinence in a male. But on a women's day, when we look at women's exclusive incontinence of urine, which is called stress incontinence, it is important to wake up and not to live with incontinence anymore. Sadly, women live on diapers, women live with leakage of urine, and something which can actually be completely sorted out by a surgery. So it's a surgical disease where the pelvic floor has turned weak. Either we do a pelvic floor repair in selected cases, or in majority of cases, it's only genuine stress incontinence where a mid-urethral sling or a tape is working very well. So why live with incontinence when you can leave incontinence or leakage of urine? Number one. Number two, women suffer from overactive bladder where the bladder makes you run. Stress incontinence does not make you run to the washroom. Stress incontinence is you get up, you leak urine, you cough, you leak urine, you jump or you bend, you leak urine. So out there, the bladder is not at fault. But then the other kind of incontinence, which is called as overactive bladder, where the bladder is overactive, it actually contracts erratically and makes you run again and again to the washroom. Something which you really can't hold. Something where you have to empty your bladder before you reach the washroom, which means you leak urine. It's a sad story. But that's what happens to women more than men. But it can happen to anybody at any age. It can happen to men, it can happen to children, it can happen to elderly people. And as age rises, the bladder becomes more overactive. That means you were a master and suddenly you become a slave. Changes of that kind of bladder's demographic, where the bladder contracts erratically and makes you run more frequently. So increase frequency of urination in day or night. Increase urgency component where you can't really postpone urination. And sometimes you would leak urine called urge incontinence is actually called overactive bladder. So these are two main incontinence issues which women suffer from. They also suffer from a recurrent UTI only because of the anatomy that women have compared to men. There were more urinary tract infection which happens to women in prime of life and in elderly women where the hormone changes are brought about, absence of any guard or a hormone outside the urinary passage and the introitus is changing and bacteria can actually invade the urinary passage more frequently. Urethral diverticulum or a small kind of an outpouching in the urethra which brings about discomfort in urinary examination or urinary passage and sometimes would cause pus to emanate from the urinary passage, a thick pus. It's called urethral diverticulum. So women exclusively suffer from some urinary lower tract issues, and on Women's Day it's important for us to wake up women not to live with women's urinary incontinence, women's urinary infections and urethral diverticulae and all kinds of aspects which actually make you feel very unhealthy, wearing diapers. I think that era is gone completely. I think it's time to take charge. This silent menace of women's urinary health can be taken care of completely by women or by ambassadors who actually listen to this and take it forward to the next level. Thank you so much.